Today on Vital Insights.
We made the commitment, and clinically we put a team of nurses together. We looked at how we could provide that care in the home, how we could generate outcomes, still stay connected to our patients, and quite honestly, do it at a reduced cost. And it worked.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future. The development and implementation of remote patient monitoring solutions into healthcare spaces has been a long and winding road, and our next guest has been in the front seat for most of that historical journey and can probably attest to more than her fair share of bumps along the way. But with a bevy of new support over the last decade and a half for virtual care solutions, from new reimbursement structures to technology advancements, a future grounded in remote care feels solidly on track. I'd like to welcome Karen Thomas to Vital Insights today, who is President of Cardeum, a healthcare consulting company focused on reducing hospital admissions, improving patient outcomes, and reducing healthcare costs through the use of transformative technologies and best clinical practices. Karen, thanks for joining us today.
Good afternoon. It's my pleasure to join you today, and I'm excited to talk about this.
Excellent. Well, let's jump right in. Tell me about how you got into telehealth and remote patient monitoring to begin with, and what clinical experience or what parts of that experience led you to the creation of Cardeum.
Well, you are so correct. It has been a long road. I actually started in 2002 when I was approached by a vendor who was offering a remote telemonitoring device. And at the time, I was president of a large home health company, and it just made common sense to me that we would be able to connect with our patients and know what's going on with them when we couldn't actually be there.
Absolutely.
And it was also a time we needed more nurses. They were working too much overtime, and quite frankly, it was hindering our growth. So we looked at the equipment and we made the commitment. And clinically, we put a team of nurses together. We looked at how we could provide that care in the home, how we could generate outcomes, still stay connected to our patients, and quite honestly, do it at a reduced cost. And it worked. But I have to say the key was being committed to the program. You had to be committed to make it work. And as time went on, we developed a telehealth monitoring company where we actually worked for large telehealth companies to be their call center, their telehealth call center, to assist others in doing the same thing that we did. And then, quite frankly, I decided that I wanted to reach further out and to touch more lives and help more people. Actually, as you mentioned earlier, maneuver those bumps in the road.
Right.
To be able to do the same thing. It was really exciting. So from there, I left and started the consulting company. And it's just been amazing what I see that's happening because there's new technology, there's new interest. It's just, it's our day has finally come. But I guess it's been nearly 20 years. I hate to say that it's been that long, but it has. Yes.
I know, not to date both of us, but I remember that too. It has been a long and winding road and a long time a coming. But I think telehealth is finally here to stay, as you just beautifully articulated. I think the pandemic had a lot to do with that. What trends have you seen emerge kind of during the pandemic around telehealth, and which ones do you foresee actually sticking?
Well, not to use an old saying, but if you think about it, necessity is the mother of invention. And what we saw was that people were going home, they needed help. We saw in the home health area, patients not wanting other people to come into their home, but needing care. The hospitals were full. We saw hospitals sending people home, but the people needed more oversight. Maybe they were post-COVID patients, maybe they were other patients. So what we saw was all of a sudden people were thinking, all right, how can we truly provide that care at home, or maybe we thought about it in the past, but now it was really a necessity. I mean, there were, PPE supply issues. So they really stepped back and said, okay, now we have to do it. They were pushed. It wasn't a matter of we'll do it when we get time. It's now we really have to. So based on that, people were reaching out. They changed the regulations. You could use FaceTime, you could use non-HIPAA compliant video, but we saw trends where people started with that, but then they said, you know what, we're going to continue to do this because two things. One, people liked being cared for at home. It was very efficient, and they found that they were getting very good outcomes. And some of the things that they thought were hesitations in the past were not, because people got it. They understood. It wasn't a matter of, oh, it's too difficult for us to do this. It was much easier. So, and even with hospital at home, the new concept. So you've got hospital at home where it started a few years ago, but now it's really taking off. You see large companies or large hospital organizations investing millions of dollars in the hospital at home concept. So
Yeah.
we're seeing that move. It's finally here, and they know you can accomplish what you need to accomplish at home. However, we'll talk about that later, but the key is you have to make sure it's the right patient and it's done properly.
Absolutely. And I think I'd love to just delve into that if you don't mind. In terms of thinking about, for technology companies who are working to bring care into the home and working on virtual care solutions, what do providers and patients really need to prepare for as we kind of move into this world of virtual care?
Well, I get asked that question often because people want to participate, they want to contribute, but the question is, what do they need to do? And companies, I think the foundation or the underlying thing that they need to think about first is one, what is the actual need in the home? And then continue to refine their hardware and adapt their software to meet those needs. So, what problem do they need to solve? So, hospital at home is a prime example. We started with remote patient monitoring, we've gone more into video. And so now we're seeing a higher acuity level of patients in the home needing care. So it's really moving, it's really understanding what needs to be done, because the key will be when companies do that, they will see more of an acceptance by the care providers. There's more collaboration. That's what companies need to do. And then as far as patients, I think what you're seeing patients, it's great what we see with patients because one, I used to hear that, oh, the older population doesn't understand or doesn't, want to do this. But I often used to show people a video. I went to a birthday party of a gentleman who was 100 years old. And guess what he was doing? He was FaceTiming with everyone that couldn't be there. So I use that to say they adapt. And with the proper education, patients are enjoying it. They see this connectivity. And I often say they don't want to go to the hospital. And sometimes they don't want strangers in their home. So, what a perfect way to continue to reach out to those patients and get that information that you need and make sure it's timely. As far as a company, that information needs to be timely and actionable. So, when you put those two together, you're really going to work with the providers. The providers get the information they need. Patients like it because they connect anytime, night or day. The connection is quicker, and companies are there to support them and see they have what they need. So it's very exciting, I think.
I mean, I couldn't agree more. Let's talk about some of the other barriers. Scalability is obviously a huge one. So in terms of scalability around remote patient monitoring solutions, what do you see as the challenges from either a hardware standpoint or a software standpoint, or even personnel standpoints?
Oh, scalability. A lot of people don't think about that when they're
Nope.
beginning to set these programs up. And everything's about scalability because at the end of the day, you need to provide the care, you need to get the outcome. And since I'm an accountant too, you have to be able to do it in a very efficient manner. So, with all that, that's where scalability comes in. So I think for hardware, the one thing that we've got to do is to make sure that hardware is, just to name a few, ease of use. So what you're seeing now is companies move into more of a passive monitoring, which makes the ease of use even takes it to a next level, particularly for certain clients that maybe have challenges or they're too ill to actually use a blood pressure cuff and don't have a family member there, or we need to measure their movements. So there's a lot of things. Ease of use is a key because it brings about patient engagement. It has to be reliable. The data transmission has to be good. And so, one, is Wi-Fi needed? Is it cellular? Can they always depend on getting the information? The appropriate price point, easily transportable. How do we get it there? How long does it stay? Is it a one-time use? Is it easy to come back? Easy to sanitize? And then is it unobtrusive and in the home and quick? Because people will engage, but they don't want to spend too much time engaging. So does it take too much of their time? So is it sending that reliable data efficiently, cost effectively, and people will they use it? Can you engage that population? And so from a clinical standpoint, which is also, clinicians are key. So never underestimate the value of their input. So once again, know the problem that you need to solve and understand what data is needed. What data does a clinician need to make the appropriate decisions regarding the patient's care? So understanding that complete clinical side and that it's timely, understandable, and actionable. So there can be an intervention once you get the data. So think about it. The data's there. So now they need to be able to do something with it and provide an intervention, which what it's all about. It's saving that person, maybe an ER visit or a hospitalization. So the other thing is when you take this data to a clinician, the key is making sure it's been tested and authenticated, because that gives that provider a comfort level to work with you and trust that everything you're giving them is for the good of the patient and it enables them to make the right decisions. So it's always been key. And so one, be able to communicate what studies have been done. Is the video good quality? Does it fit well in the workflow? And at the end of the day, is there a return on investment? Is it going to save? And particularly now, because so many providers are involved in some sort of value-based care.
Yeah.
So it's key that they know that they're going to be able to save money because it completes that circle. Value-based care, quality improvement, quality care, timely interventions. It just really completes that circle.
I love that. I love that summary that you just gave of basically the entire issue. I've never heard anyone do that well. That was amazing. So let's shift gears just a little bit and focus on the patient for a second, because when anytime we're looking at any virtual care, remote patient monitoring solution, we have to consider compliance. Right. So everything kind of falls down at that front line. You can deliver the most compelling solutions in the most slick formats. But if somebody doesn't actually use it, if they forget to take their blood pressure on a regular basis, if they don't want to get on the scale after they had Chinese one night or after their birthday party the night before, those things can impact the validity and the ability of the provider to deliver good care. Right. So from a compliance standpoint, how do you see those issues impacting patients and providers and payers, even for that matter? And how does that kind of factor into the overall delivery of a solution like this one?
Okay, well,
sorry, that was like a 7-part question. I can break it down a little bit more if you want.
I think I got it. So I may not be able to repeat it back to you, but if I miss anything, ask. But I think we can start out with payers, very simply put, and not oversimplifying it, but at the end of the day, whether it's CMS, it's an insurance company, a managed care company, a self-insured employer, at the end of the day, No one wants to pay for something that the patient or member will not use.
Right.
And so, I mean, it's as simple as that, because if they don't use it, there's not going to be the savings. They're not going to be able to improve or manage that person's care. And so they're looking for an outcome. And, I have to interject here. As we monitored for people and we provided care, we really always sold an outcome, not a program, because the program is, the technology and all this really comes down to one thing, and that's, did you improve a patient's outcome, which in turn will reduce cost. So that's what the payers are looking for. And so with that, payers, yes. But when it comes to the patient, I always like to think of this as a three-legged stool. All right. So you've got a telemonitoring company or a device company, and you have a provider and you have a patient. All right. So if one of those three are not doing their job, the stool falls over.
Right.
So you have to have the engagement of the patient. So they have to be able to use it. And so when they are using this device, then they're going to be providing the information that that provider needs. But engagement or compliance can be different things. So there's different populations. So if you think about this particular device that we're talking about, if you think about a passive device where you can collect the data, you can reach out to one, maybe just a non-compliant patient, but you can also reach out to populations that are more challenged. Maybe they're actually so sick and not having the sources of family caregivers or someone in the home to actually take their vital signs themselves. You can also reach populations that are challenged in one way or another, or the dementia. Look at dementia
Yeah.
and how you could actually reach out to these patients. So you're taking care of the compliance in that area by actually doing it for them, making it very easy for them, for the providers to get that data where they might not even try otherwise. Because when you've got a provider, whoever's monitoring this patient, it's expensive to have to keep calling and say, please take your vital signs, or you didn't take your vital signs today, or why are you not compliant? This way, you get that compliance. It's already there, and it's one less thing that you have to worry about, and you can look more intensely at what's going on with the patient rather than trying to get them to support their leg of the stool per se. So I think compliance is key. You've got to have it. And then providers look at it as time consuming. And if the patient complains or they don't want to do it, then they're less likely to use the equipment. I mean, it takes more time and it's harder for them to see the benefit of it. Thus, it makes providing care virtually very difficult. So it's important that you find one way to get that compliance. And what we're talking about today, it takes care of the compliance issue, because those vital sign readings are coming in automatically. So it takes care of that for them.
So let's talk about data a little bit, because you mentioned that with respect to patients in your previous answer. You are very familiar with early sense technology, and so you know that it's kind of founded on the idea of this kind of continuous monitoring as opposed to more traditional kind of spot checking. And I don't see them as mutually exclusive. I think they coexist very beautifully and very elegantly, actually. But do you see a different value? And this seems like a very obvious answer, but I'd just love to hear you kind of expand on it. Do you see an inherent value to continuous data versus kind of that more spot checking traditional method?
I do. I do. And I like the way you put it. They're not mutually exclusive. And so let me give you some examples of where I see, defining this right patient and utilizing the continuous data. So let's just think about this. Trend data is always very useful. So I can see many times, and I've seen it happen and take time with my call center, but a patient's blood pressure is high. And so it's one point in time. It's one point in time that you're getting that reading. So someone calls to say, well, why is your blood pressure high? Well, you can tell that they forgot they were supposed to do it and the alarm's going off and they basically ran to take their blood pressure and now it's high. Well, so that patient's probably going to be okay, but someone had to call. You see what I mean? So
Right, right.
it's that one point in time. But what we're talking about here is it's the use of trends, and it's obviously more than one trend, but it's the use of trends. So it gives you the opportunity to see things, to be able to communicate to a physician. So here's what happened at this time, and here's what is happening at this time. So you can see maybe the trend goes up and down, maybe the trend is escalating, the wrong direction on a continual basis. That kind of information is going to give more, it's giving more information to the care provider for them to base, how do they base their decision? What do they, what did they say about this patient? What do they want to do about that patient? So you're giving them trend data, which is providing them more information. So think about this. Think about different ways that you could use it. You can see, one, movement. In the evening, you're not going to see, someone running to take their blood pressure. So you can see leg movement during sleep, which is an indication of a number of things.
Mm-hmm.
You can see that activity level. And one of the things that I like to see, not technically, but within, as far as a trend, you can actually see when you're trying to control pain, the movement in sleep, for example, that gives you an indication that that pain medication is starting to wear off before the patient actually wakes
sure.
up and
Yep.
pain is broken through. So there's many different ways that the more you understand the trend data, the more it gives you the opportunity to determine what actionable data you have and how you want to intervene and take care of that patient. So it's many points in time.
Absolutely. I couldn't agree more. And you touched on something that I think is really valuable, and that is, so I'm going to ask you this next question, and then we'll do a kind of a wrap up question on what you see as the future of virtual care. But I want to talk a little bit about the shortage of healthcare resources. I mean, you and I have been talking about this shortage for years, and in fact, you opened talking about it. Obviously, the pandemic only exacerbated that. So, do you think technology at this point in time has finally the capability to really step in and address that in a comprehensive way?
I do. And here's the reason why. People are trusting the technology now. And I work with a number of different clients. And so if you just think about, you have a valuable asset. Let's take nurses, whether it's nurses or physicians. You have a valuable asset. So if we start with nurses or anyone who goes out to the home to see a patient, things that you don't think about. So drive time, windshield time. So this nurse is traveling from point A to point B to see someone. But what's going on between point A and point B? You have wasted time with this valuable asset. So the same way with a physician, you have a lot of, you have visiting physicians that go into the home, or even physicians in the office. So anytime they've got this data, they might rearrange their schedule. They might not have to drive out. They may make different decisions in the office. So the key is this. So anytime that we're providing reliable and actionable data that is important to that caregiver, what they're wanting to see, then we've enabled them to, one, have more information and maybe not do additional research before they make a decision. When they're talking to a patient over the phone, you're reducing time to go out. So anytime that we can provide a caregiver that kind of data and enable them to manage with the same quality more patients, then we are one of the solutions to this shortage.
That's fantastic, and I couldn't agree more. So just to wrap up, and I just want to say thank you again for joining us today, but I would like to end with one final question that I always like to ask people, especially people like you with your expertise in this space. When you dream about the future of healthcare, well, and, it's
no more nightmares.
No,
right?
no more nightmares. When you dream about the future of healthcare, what do you see as the future as it pertains to virtual care? And are there any roadblocks for getting there?
Well, I'll start with maybe what a roadblock is because I always want to end on on a positive note.
There
But I
you
think
go.
yes, I think the roadblocks are um, learning how to use it to actually change your method of delivering care because you can't just add it on top and say, oh, we do video visits now, or we have remote patient monitoring. You have to change your delivery of care to efficiently integrate that technology. That's one thing. So people have to learn to do that. I think the other thing is healthcare always takes more time than I think it should, but maybe not more time than it should. But I think that now, though, that has been a roadblock, but I actually think we're starting, the more it's a snowball. So the more it's accepted, the more it's going to be accepted. And the more people are going to do it. And then a lot of people don't like to be the one out front, but they're quick to follow. And a lot of people need years of data, and we have years of data.
Mm-hmm.
So I think we're getting to that point. And the other thing, I think the future is bright because believe it or not, CMS has come around.
Oh, yeah.
So, I was told years ago, follow the money. And so let's just talk about follow the money now. So you have a hospital at home company who's been given $100 million by two hospital systems as an investment. You have CMS giving hospitals waivers to provide care, hospital care at home. You have CMS who has now allowed home health to count it as an operating expense. And in addition to that, we are paying physicians for remote patient monitoring. And just this July, they have issued new codes to include additional therapeutic monitoring, for example, for respiratory. It's a respiratory code. So there's more codes coming. So anytime that CMS is to that point where they believe there's enough data that they're willing to pay, I think the future is bright. I think people accept it. People are getting so they like it. They're accustomed to it. A lot of them want that hybrid. I want to see my doctor sometimes, but other times I want video. And, people are savvier as far as technology than they used to be. So I think that, as one of our past CMS heads said, the toothpaste is out of the tube. I think that we'll have some audits. They'll make sure that there's not overuse, but we have to expect that. And I've seen managed care companies starting to pay for programs to reduce their costs, both Medicare and Medicaid. And in addition to that, states are paying for Medicaid chronically ill programs. So it's like we've turned the corner. And, we've only been in it a few years, but took a little while to get here. But I think we finally turned the corner where it's not alien or foreign to us anymore.
I agree. I believe that long and winding road we alluded to earlier has finally come to a resting point, at least a solid destinational point in the map.
I think so too.
Yeah. Well, I want to thank you again so much for being on the show with us today. It was great to talk to you again, as always. If people want to know more about your consulting business, is there a place that they can go to look you up?
Yes, it's Cardeum, CARDEUM.com. Very simple, Cardeum.com. And I would love to talk to people, even if they just have questions, because as most people can probably tell from this, I'm extremely passionate about changing our care delivery program and being able to make it more efficient for our caregivers, our nurses and doctors, and still generate some awesome outcomes. So I'm very passionate about this and be glad to talk to people. And I have to say, it's been great talking to you again, too.
I know. We'll have to do this again soon.